and thank you for joining. My name is Dr. Anant Bhan, and I'm delighted to be chairing this session. I represent an organization called Sangath, which is based in India. Sangath has been working for the last over 25 years in a range of public health areas, with mental health being one of our core areas of work. This specific session focuses on child and adolescent mental health financing and is hosted by the GMHAN Financing and Child and Youth Group, and is part of the GMHAN annual meeting. For those of you who might be new to GMHAN, it's the Global Mental Health Action Network. It's an open community of mental health professionals who share a mission to protect the right to good mental health and work together to advocate to improve political and financial support for mental health across the world. And this is, of course, done through the over 1,900 members, which hail from over 117 countries, with a mix of academia, government, UN agencies, the private sector, and civil society. It is the largest global mental health network of its kind in the world. Specifically in today's webinar, we aim to explore the synergy between financing and work in the child and youth mental health areas. We hope that we will be able to highlight action needed to increase financing for child and youth mental health, and also that we will be able to convince you that there is an urgency and also equip you with the knowledge and tools to take action on this topic. So why is this area an important area? If you look at data from a variety of organizations, including the WHO, it is estimated that close to 1 in 7, that's almost 14%, 10 to 19-year-olds experience mental health conditions of some kind or the other. Yet these remain largely unrecognized and untreated. It is estimated that almost 3.6% of all 10 to 14-year-olds and 4.6% of 15 to 19-year-olds experience an anxiety disorder. Depression is estimated to occur among almost 1.1% of adolescents aged 10 to 14 years and 2.8% of 15 to 19-year-olds. Now, of course, as we've been dealing with the pandemic over the last 2 years, this has brought forth a complex array of challenges which had mental health repercussions for everyone, especially children and adolescents. This included issues around grief, around fear, around uncertainty, around social isolation, around increased screen time usage, parental fatigue, and all of these factors and many others have negatively affected the mental health of children and adolescents. This has clearly impacted their education, their socialization, and their access to services, including health and mental health services. UNICEF has highlighted how the mental health of millions of children worldwide has been put at risk, with at least 1 in 7 forced to remain at home under nationwide public health orders or recommendations during the COVID-19 pandemic. This, of course, is true of many countries which saw extended lockdowns happening. More than 330 million youngsters have been stuck at home till March of 2021 for at least 9 months, since the virus spread uncontrollably around this time last year. Fortunately, since then, we've had some easing of restrictions, but of course, the pandemic still remains a challenge globally. It is important here to highlight that globally, governments spend an average of just 2.1% of their overall health budgets on mental health as per WHO, and only a small fraction of this modest expenditure goes to the most vulnerable, such as children, adolescents, and caregivers. Remember that already health from an overall perspective remains underfunded in many parts of the world, especially low and middle income countries. So if we are dealing with a small sort of bucket of money, out of which a much, much smaller proportion is actually being spent in mental health. The failure to properly fund mental health has resulted in huge treatment coverage gaps in mental health services, as wide as 90% in some low-income countries. And the funding that does exist is usually focused on central mental health facilities, especially in urban areas, which might be often far away from young people's homes and are usually not designed to respond to their specific needs, are not accessible. They might not be children and adolescent friendly, and they might not be community-based, which is perhaps a more effective and cheaper approach. So discuss all of this and why we need to change that through bringing focus to child and adolescent mental health and to financing. We have an excellent panel today. It's my privilege to introduce our panel members and invite them to share a little bit about themselves before we get started. So Valentina, if I could request you to go first.
Yes, sure. Thank you, Anant. So good morning and afternoon to everybody. I'm delighted to be here with you today. My name is Valentina Yami. I'm a fellow at the London School of Economics and Political Science in the United Kingdom. I have over 10 years of experience in research in global mental health policy, with a specific expertise in governance and financing.
Thank you, Valentina. Lovely to have you. Steph, can I ask you to go next?
Thanks very much, and thanks everyone for having me today. So I am Stephanie. I'm the co-chair of the Child and Youth Working Group for the Global Mental Health Action Network, and I am the head of Global Impact at Batyr. So we are a preventative mental health organization for young people, led by young people in Australia. I'm based in Canada myself, and have close to 10 years focusing on peer-to-peer models and how lived experiences can really drive us forward to create real change.
Thanks, Steph. I know that you've been involved in a lot of these conversations already, so we will look forward to hearing from you about what the summary of some of those discussions might be. Dan, if I can go ask you to go next, please.
Okay, thank you very much, and good morning, good afternoon, good evening, everybody, wherever you are, and delighted to be joining this this panel today as part of the annual meeting. Yeah, my name is Dan Chisholm, and I'm based at the headquarters office of WHO, and I have I dread to think how many years working in mental health, economics, and finance. So hence my interest in this particular topic that we'll be discussing today. Thank you.
Great, thanks, Dan. Good to have you. Reena, can I ask you to introduce yourself as well?
Thank you, Anant. Good morning, good afternoon, good evening, from wherever you're joining. My name is Rina Tuma. I work for the Population Reference Bureau, and I'm based in Kenya, specifically Kwale County, coastal region of Kenya. I work as an adolescent and young people technical officer. I have worked in the public finance management space for over 5 years. I come in with a bit of experience on gender responsive budgeting and child-centered budgeting, and I'm glad to be here and also looking forward to the webinar. Thank you.
Great, thanks, Reena. So lovely panel and very pertinent expertise with respect to the topic today. So I'd also like to welcome everyone who's joining us today as participants in this webinar. And if I can request you to share any comments, questions that you might have in the chat window. To get us started, Valentina, if I can request you to talk about what is the situation currently for mental health financing, and especially so for children and adolescents.
Sure, good question. Here the background. So what we know about the funding for child and adolescent mental health is extremely little. The evidence suggests that resources are extremely limited and often misallocated. So we can look at two things, government fundings and donor fundings. When we look at governments, as little as 2% of governmental budget is allocated to mental health in average across the world. And a portion of this is disbursed for activities targeting children and adolescents' mental health. It's worth noting that this figure is lower for many low and middle income countries where most of young people live. Now, funding is not only limited, but is often misplaced, as it's mostly allocated to tertiary and secondary mental health services, such as hospitals, instead of primary and community-based mental health services, such as community health workers, which has been shown to be more effective. When we look at donors, the figures are similarly low, as little as 0.4% of development assistance for health is allocated to mental health. And out of these already low statistics, the amount allocated to child and adolescent mental health is a small fraction. About $1 out of $10 of development assistance for mental health is disbursed to activities targeting children and adolescents. Again, funding is often misplaced, and most of the aid, the development assistance for health, allocated to children and adolescents are disbursed to the humanitarian sectors, and little to community-based mental health services and sector outside health, that are crucial for children and adolescents, such as education. So funding for child and adolescent mental health, including governments and donor fundings, are both limited and often misplaced.
Thanks, Valentina. So clearly we're talking about meager funding overall for mental health relative to many other parts of the public health landscape. And even there, specifically for mental health, we have a much smaller amount of money being spent by both donors and governments. And of course, a much smaller proportion being spent on children and adolescents. So Stephanie, if I can ask you to maybe talk about what are the kind of key gaps hence that we need to address to improve financing in this sector, especially for children and adolescents.
So there are definitely quite a few gaps. So I might flag a couple. One is that when you think about it, the individuals that are holding funds in their hands are adults. And although we've all been young people at one point in our lives, a lot has changed in the world and there is a big disconnect there. And so it's really, really important that I think something we need to be doing to improve the way investments take place is ensuring that we are working directly with children and young people and adolescents to actually understand their real-time needs and what specifically is going to help investments go farther. Because if we can really target what actually is contributing to challenges young people are experiencing, and if we can go deeper to kind of look at the systems that operate around young people, we can learn a lot, but we can also learn a lot around what can help, what supports with recovery, what supports with prevention. And it's really, really important that we're getting this information directly from young people. And the second thing that I just wanted to flag is I think that we really need to challenge the way we think about how we make investments. Oftentimes, investment is looking at a pilot or a short-term solution, and we really need to think about what can we do to create long-term sustainable change. And oftentimes that takes working with other funders and collaborating with multiple organizations, or being able to think about multi-year investments that will also fund things that might not look as exciting on the surface, but are necessary to allow an organization to run. And I just will point out as a wrap up that because of how important this issue is and because of how many opportunities there are to change the way we think about funding, the Child and Youth Working Group and the Finance Group have worked really hard together recently to create a briefing that is now online. And we encourage everybody to check out, as it has very clear recommendations there and gaps, and we can all work really hard together to try to fill.
Great, thanks, Steph. And the link to that document, I presume, will be shared in the chat window for everyone. Dan, one of the things, of course, clearly we need to do is advocacy. We need to do advocacy with donors, with governments. So is there an economic argument to be made here about prioritizing mental health services for children and adolescents? And can you also draw from the recent excellent WHO report, which has come out speaking to mental health?
Yes, thanks very much. Yeah, I mean, should we be prioritizing financing for child and adolescent? I think that's quite a leading question. So I'm not going to disappoint you by saying yes. I entirely agree that it does require prioritization. I'm a bit biased in this regard, I admit. But before coming to the economic arguments, I think when we're talking about prioritization, there are actually several arguments which we can enumerate and which you will find also in the recently published World Mental Health Report. And the first argument, of course, is a public health one. And as Valentina already mentioned, and you mentioned in your opening comments, the frequency, of the high prevalence of mental health, behavioral, neurological, substance use conditions. We put all those together, it's extremely common. At least 1 in 5 of that age group between 10 and 19. And of course, suicide is a leading cause of mortality in that age group. So that itself is a very important argument for prioritizing better services in its own right. And then the second argument, of course, is that right now there aren't any services in many places. The recently published, the last WHO Mental Health Atlas, for example, showed that, we asked questions about child and adolescent mental health services and particularly human resources. So in high income countries, there's like 20, a median of about 20 workers for that population per 100,000. In lower middle income countries, it's 4, and in low income countries, it's virtually nil. So that shows the kind of scale of the problem that we're facing in more resource constrained settings. And part of the problem there is that, of course, child and adolescent mental health conditions are they're not well understood, they may not be well accepted sort of socially, they're stigmatized, and all of these have an effect on the demand for services. And that, I think, also helps or enables decision makers to either overlook it or deny, the resources that are actually needed. A third argument is around rights and equity and inclusion, which are all fundamental principles and objectives that countries the world over aspire to. Mental health is a human right, as we point out in the report. So children and adolescents with mental health problems or issues are entitled to appropriate and decent services. So that's the third one. And then moving to the question, the economic argument, I think that can be split into two kind of main points, main strands or dimensions. The first one is an efficiency argument, which is to say that we do have interventions for preventing and treating these conditions that are not only able to improve health, but have also been shown to be cost effective and affordable, even in low-income settings. Of course, we don't have enough studies, but we do have enough, I think, to show that these interventions can both prevent anxiety, depression, and self-harm, for example, through school-based social emotional learning programs, but also enhance remission and recovery for anxiety, depression, epilepsy, and so on. And then the second argument, and then I'll stop, is the return on investment over the longer term. And the important point about this is that these studies go beyond the health impacts. They consider also the so-called non-health impacts, particularly improvements in labor market participation and productivity. And here we have a fantastic new study that's been undertaken by the Research Triangle Institute in Washington State by Rachel Nugent and colleagues. I'll send the link in a second. They did a study across 36 countries of the return on investment of several interventions for this population, and found that for every dollar invested in adolescent mental health interventions, you get over $20 back in restored health and productivity. And that's in high income countries. In lower and middle income countries, it was like more than 50. So an incredibly good return on investment. So what more? I mean, that's the evidence we need, so this is very timely. Back to you, Anant.
Thanks, and I think that's pretty convincing, I guess, to all of us. But we are part of those who are already converted. We really need to take these messages out to the policymakers and funders, and hopefully webinars like today's will help serve that purpose. Reena, I want to invite you to talk a little bit around what does this mean on the ground for children and adolescents. We can keep talking about data and numbers, but as someone who's worked for many years in this domain, what impact does this have for a child or an adolescent who's struggling with mental health issues? And what do we need to tell our governments about increasing financing for services in this domain?
Thank you, Anant. One, I'll start by talking about issues of mental health. And when we look at, we're talking about unresolved mental health issues at childhood level, have an impact or can result to an enduring consequence, which might be long-term up to a person's lifetime. So we look at youth also having difficulties struggling with mental health issues. In Kenya specifically, the number of HIV-infected youth, because I also work in the HIV field, quite a number of them are young and young people and the youth who are mostly affected. When you talk about the unemployed in the society, majority are the youth. So there's a need for us to talk about these issues around affecting the mental status of the young population in our countries. And specifically, I'll also give a context for Kenya. Out of a budget of around Kenya shillings 120 billion, only 0.01% is allocated to mental health issues. And when we talk about mental health, it's specifically on mental health institutions, investment in mental health institutions and that. And it's not on the integrating of mental health issues within activities that the government or the services that the government is providing, and also the non-government institutions. So there's clearly a need to increase financing for mental health. And one is because we're talking about access to universal health coverage. How do we achieve that when we're not able to finance fully all aspects of health, including mental health? And we cannot overemphasize that mental health is a health right as well. Also looking at not only is it being a sure way of achieving universal health coverage, the economic benefits of investing in mental health. When a community is mentally stable, we're able to thrive, we're able to see people working efficiently and also producing the right capacities to be able to make our economies to thrive. Then we can talk about the overall individual well-being of societies. So when you look at the younger generation, and I like the agenda of the webinar today, we are talking about funding the future. So we are looking at investing in young population, and that long-term investment is able to be seen and also translated to further generations that are coming, and the benefits can not be outweighed from perspective of mental health financing. So I think from all that, there's clearly a need to be deliberate about investing in mental health issues within countries. Thank you.
Thanks, Reena. Absolutely on point on all of those aspects. Valentina, if I could circle back to you and ask you, now we sort of identified the issues. We know that there is underfunding. We know there is an urgency. So how do we move forward? How do we increase financing for this sector with a focus on child and adolescent mental health?
Thank you, Anant. So my answer to this question is in summarizing one word: integration. So I believe that we can increase finance for child and adolescent mental health using an integrated strategy to investment. And this will mean including mental health components in investment across different sectors, touching different areas of the life of children and adolescents, such as education, employment, as we have been mentioning, or urban planning. So now, if we think about this integrated strategy, this is not new. There are many examples of successful intervention for child and adolescent mental health beyond the health sectors. And you can refer to the World Mental Health Report that has been just published for some good example on that. For instance, we know that psychological counseling in schools is effective. Vocational support for young people with mental disorders joining the workforce is effective. And we know that it's important to create mentally healthy environments, such as green spaces. Now, this integrated strategy has the advantage not only to be beneficial for addressing mental disorders, but also for amplifying investment across other sectors. So I believe integration could be a promising way to increase finance for child and adolescent mental health.
Thanks, Valentina. Great point around the need for integration. Steph, if we were to think how things could be different, say 5 years, 10 years from now and longer, what would be possible? What would be different if we really did invest significantly in young people's mental health? What kind of changes do you expect to see?
It's a big question because there's just so much I think we can allow ourselves to think about. But one thing this makes me think about is that if we truly invest and do it right, we think about the long term as well. Not only will we be impacting children and adolescents and young people, but if you think about anybody in our lives or any of us on the call who has experienced mental ill health or a mental health condition, it doesn't only impact that one person, but families, communities, carers, schools, workplaces, the list goes on, everybody. And so there's a huge ripple effect there, which means that if there's a ripple effect when somebody is, going through a tough time, then there also is a ripple effect if we actually can create changes when it comes to how mental health is looked at through investment. And so what I think is that in the next 5 to 10 years, not only will we see a healthy generation of young people, but we will see healthier people surrounding young people as well, which I think is so important for communities all around the world. And but I think for us to really do that over the next few years, what we need to do is really think about, well, where, we're hearing a lot about the limited investment that is taking place. And if we look at where some of this money is going, oftentimes it's going towards the crisis side of things. And unfortunately, what that means is that we're meeting young people downstream when people are in a state of crisis already. And I think that if we actually flip this a little bit and we think about how can we actually catch young people upstream and focus more on prevention, health promotion, early intervention, we can help young people grow up with lifelong skills to build resiliency, to know how to look after themselves and their peers, for families and carers and communities to help support one another as well. And so the prevention, early intervention, health promotion side, I think is imperative for us to look at some of these long-term effects. And again, thanks to James for putting the link to the briefing report in the chat. I'd really encourage everybody to check that out as we are launching that today, and it can really help us dream a little bit bigger. But to do that, we need to take some steps forward, and I think that report outlines some specific things that we can do.
Thanks, Steph. Agree with you totally that we need to really have a lot of focus on prevention and promotion, and of course also ensuring that services are available in a child and also friendly way. So Dan, if we're thinking about financing, what is the kind of financing that we need to speak about, and does it differ in any way with when we are targeting children and adolescents from a mental health perspective?
Well, yes and no, I think would be my short answer there. Let me explain. I think from a health system financing perspective, the answer is no, because there shouldn't be health financing for child and adolescent mental health, just like there shouldn't be health financing for TB or for NCDs or any other condition you care to mention. There is health system financing, and the allocation of resources to specific areas or interventions should be driven by priority setting as well as provider payment arrangements. So, resources to fund child and adolescent mental health services specifically, will mainly be national, domestic, and need to come from non-vertical mechanisms, by which I mean general taxes and the general budget. So I think that's the first point to make. That's the health system financing perspective. But from a public mental health perspective, I think we can make a bit more nuanced response and answer, a kind of a maybe or even a yes. And that would be on the grounds that there are some strong reasons, some of which I already mentioned, for the long-standing underinvestment in this area. I mentioned, for example, the influence of stigma and misinformation, misunderstanding, but also the perceived and actual, quality of services and care in many countries. which also depresses the demand for services. So things are partly out of balance. It's sort of, think of it like a market failure. And when there is market failure, there is a rationale, a justification for writing that through corrective measures. So, and through that, make a sort of deliberate or special effort to stimulate or provide additional resources for a neglected area. So I think at the domestic level, some areas would include, for example, inclusion of child and adolescent mental health in post-pandemic recovery plans, and funds, which there's suddenly a boost there, or in the form of new investments from outside the health sector, like Valentina mentioned, the social care or education, community services as well, to enable, construction of youth centers for well-being, or so linking it to some of those broader development concerns that countries have. And I think, both child and adolescent mental health and other areas like suicide prevention are very good examples of areas where multi-sectoral action, beyond the health sector is not just kind of desirable or good idea, but actually required. It's essential. And then at the level of the kind of external funding, new resources could be secured through a range of sources. I mentioned some of these at one of the other webinars we had on financing in the context of UHC, the bilateral or multilateral donor funds, because actually many of those are still quite verticalized. So we're saying we shouldn't be pursuing a vertical approach, but the reality is that there are vertical approaches being used, and that's where billions of dollars of investment is being invested. Sorry, I'll just stop that call. So things like the Global Fund for AIDS, TB, and malaria, that disperses around $4 billion per year. Global Financing Facility, which supports low and middle income countries to accelerate progress on maternal, newborn, child, and adolescent health. So why not? If we can include mental health better in those quite vertical programs, that's an important source of potential funding for countries that are eligible for that kind of support. Back to you, Anant.
Thanks, Dan. Very much relevant. So, Reena, if you were in an elevator with a bunch of funders, what would be the one thing you would ask them if you had a minute with them while we were going to the World Health Assembly?
Thank you, Anant. I will choose what Valentina has just mentioned: integration of financing for mental health, looking at specific projects that we're coming up with, and how do we integrate issues around mental health. For example, I've worked in the gender space for a while, and you will be asked, how are you integrating gender issues in the activities that you're undertaking as a program? So we could also talk about mental health issues, because we also need to look at mental health. Sorry, there's so much wind where I am. We need to look at it from a holistic perspective, where we're looking at the mental health of not only the individuals working, but also whom we are the beneficiaries of a specific project. But we also need to look at it in silos, where we're looking at mental health of different categories. And then down here we can talk about child mental health, youth mental health, and now different categories, and how do we address them differently. So I will talk to donors and urge, one, we should increase financing, and financing not only has to be specifically that the project is targeted at looking at mental health as its key or major objective, but how do we integrate it within a project that is already existing, or a program that you're coming up with. Thank you. And over.
Thanks, Reena. So, none of us are children and adolescents on this panel, but of course, we've all gone through those stages. How important is it for us to also get voices of young people to be part of these conversations, to be part of the advocacy? And how important would that be from a financing perspective? Do you think that should be part of our advocacy center staging voices? So this is again open to anyone in the panel, your own thoughts, and if you have worked with young people and as advocates for their own mental health needs, how has that gone? And is that an effective strategy in any way? So invite any of you who would like to maybe speak to that. Yes, Steph, go ahead.
Yeah, I'm happy to jump in. I think that it needs to be central to funding decisions. And I think we are starting to see that more recognition of the value of ensuring that young people have a seat at the table, because I think it is, if we think about the limits around funding worldwide, it's important that we can feel more confident that the investments that are occurring are going to the things that are actually going to make a difference. It means that our money is going to go farther. There will be more impact. It'll be more effective, and we can do more with it because it's actually targeting the nuances that need to be targeted for young people in a local community. And I think that, I've seen this done well, through the work that we do in Australia, for example. We have a national advisory group of young people, and we have a young person on the board who play a central role in advising us in the work that we do. And the thing that we're seeing is that young people want to have their voices heard, and they want to be a part of these conversations. The challenge is that a platform, there isn't always a platform that exists for that, especially one that isn't tokenistic. I think, though, a challenge with this is that we need to ensure when we are including, when that young people are part of these conversations, that there isn't this pressure placed that one young person is representing the voices of all young people around the world. We need to make sure that we're working with young people in meaningful ways, and that we're getting diverse approaches and perspectives, and that we're willing to take action based on the information that we're hearing as well.
Great. I heard diversity there, I heard inclusion, but I also heard accountability. If we bring young voices to the table, then whatever they bring to the table should also be responded to, and I totally agree with that. Valentina, were you wanting to add something to the conversation this as well?
Yes, I think I completely agree with Stephanie. Very good point and very good example. And I think that young people should be central in the decision-making process, not only in terms of their inclusion in a democratic process and their representation, but also in terms of prioritization. So we need to, and the effectiveness of our investment, we want to invest in something that is meaningful to the recipient, to young people. And the way to do that is to make sure that whatever we do is something that young people want and value. Thank you, Anant.
Thanks, Valentina. So Dan, if I might ask you, from a health systems perspective, how do we design services to be focused on the needs of young people? And then how do we advocate hence for funding for those services? What do we know from the science so far?
Okay, well, there's several things to be done. The first is having a decent understanding of the situation on the ground, right? I mean, situational assessment of the population level needs, because without that, it's you're already on the back foot, I think, so you've got to do the homework, and ideally that's going to be, doing a proper, nationally representative epidemiological survey. In the real world, that's a rather expensive thing to do, particularly on a regular basis. So might need to rely on available information from outside the country or the region, or make some estimations. But several countries, each year are carrying out these kind of population level estimates, and that puts you on a firm footing and say, look, this isn't just us advocating. I mean, it is, but it's using evidence to advocate to say there is a genuine need there. And then, of course, to meet that need, you need a whole range of things. You need policies and plans that support an agreed set of objectives and actions about what are we going to do to meet those needs in the population, whether through health services, through other sectoral engagement and action. You need the resourcing, which we've been discussing. And then you need training. I mean, you know, that there just are not, the workforce is totally inadequate in many countries. And there's a huge problem there about how to build up the workforce. I think, you know, the COVID experience has, you could say, certainly shifted attitudes and encouraged many countries to rethink their mental health workforce and how they can build that up, but it takes time. So we're talking both about specialist providers, which are in chronic undersupply in high income countries, as well as lower middle income ones, but also non-specialists, of course. And this is where programs like WHO's GMHAN comes in, because you can build up the ability of general healthcare providers in primary care, for example, whether it's doctors, nurses, in the identification and management of the more commonly presenting conditions. So it needs all of those things and more, and monitoring and surveillance. I could go on, but those are some of the key building blocks, I believe.
Great, thanks, Dan. Very useful. Reena, how much of an issue is stigma, especially because I think this is something we need to speak to as well. There is stigma around mental health conditions, around access of mental health services. And does that impact our ability to also advocate for mental health needs? So is that something we also need to speak up about societally and with our policymakers?
Sure. And speaking from an African setting as well, mental health issues are considered in some communities witchcraft, in some communities probably a misfortune that, or probably something that is happening to a specific family as a result of some past mistake or whatever. Could be different communities perceiving mental health issues differently. But again, we look at this as drivers and perpetrators of stigma in society. Some mental or most of mental health issues are medical, and when they are identified early enough, individuals are able to get the right interventions and they're able to go back to their normal state. So while we're talking about increasing of financing for mental health, we're talking about donor support, government to be intentional. We're talking about the workforce. We really need to look at also our attitudes as communities in terms of access to mental health services. How do we look at mental health status of patient, and also looking at mental health issues as something that could happen to anyone. For example, a person battling a lifelong disease is likely to get a mental health issue, issues of anxiety, depression, and all that. So categorizing and treating the conditions, as well as looking at the holistic well-being of the individual with less judgment would be a proper way of us achieving these goals. Because when you talk about the financing and then we are not utilizing these resources because there's a lot of stigma, then we'll not be meeting the goal of what we are looking at in terms of mental health financing and what it's going to do and what it's supposed to do as we look at it. Thank you.
Great, thanks, Reena. You know, it's very important that you highlighted that it's not just about financing, it's also about effective utilization. In many countries, including the context where I've worked, this is often a challenge. You know, sometimes there is not enough money, but whatever meager amount of money is available is also not sometimes effectively utilized. And part of that is, of course, also ensuring that we respond to issues around stigma, some of which also operates within the health system and among health providers. You know, a lot of health providers are not very keen on treating mental health conditions. They tend to, you know, not provide care or refer patients to specialist care, which might be, you know, in scant supply, which might not be available locally, and that means that the treatment gap continues to exist. So certainly something to talk about. All right, so I think we're going to now pivot to some of the questions which have been coming from our participants. Dan, one question for you, perhaps. The issue around the fact that access to services and stigma are obvious issues in all countries, but do we really think that we have all the treatments and interventions we need for young children and young people? where are the R&D gaps for new approaches which need to be prioritized as well? And of course, part of that will be funding for these R&D approaches. So thoughts on this?
Well, I mean, of course, we all argue for the most comprehensive set of possible interventions, and we're still on the discovery path and finding, new and better ways. So that's innovation and research agenda. But I think I come back to, let's just get the basics, any intervention. So we certainly have enough evidence already available to us about a range of interventions which can both help to prevent and also manage or control or improve recovery through treatment approaches. So in that sense, we have enough to be going on with, and there's no excuse for not implementing this and investing in this basic set of interventions, which we already have the evidence for. So, of course, we're always looking to do better, but we have enough already.
I might just add to that as well, Stan. I think those are great points. You mentioned implementation there, and I think that's really important. As research and development is funded, I think equally there needs to be funding in the implementation side of things, and also looking at, well, how do these findings translate into practice? What does this actually mean for the education system, for the health system, for communities, for policymakers? And how do we ensure that this information is actually being heard? I think there's another question there about policy as well. How do we actually translate the findings that we're learning to ensure that they're being listened to and acted on by decision makers and policymakers as well?
Absolutely. The whole issue around the evidence to policy and evidence to practice gap, which often exists. And sometimes, unfortunately, it takes years for that gap to be met. And by that time, the science is already advanced, and you might have a better set of services available, better set of responses available, and you're always playing catch up. Valentina, one of the questions focuses on the fact that we've all talked about the high returns on investment. Then why is it that policymakers are generally perhaps not willing to meaningfully increase funding for child and adults in mental health? Is it because the returns might not be immediate? We're talking about longer term sort of returns, or are there other reasons why this kind of investment is not happening?
Excellent question. So this question is touching on the tensions between the evidence available and the politics of decision making. So very often we can have the best evidence at our disposal, and we are starting having pretty good evidence. As Dan mentioned, this study on global return on investment was just published, which is excellent. But unfortunately, those decisions are political decisions at the end of the day. So evidence is one piece of the puzzle, but there are many factors that are intervening. This can be dependent on the social value of a particular country. These can be dependent on political priorities of policymakers, so for their political careers, or to external shocks. So Dan have mentioned COVID. COVID is an excellent example of something that has impacted the entire world and that have pushed mental health up in the agenda, because it become one important issue across the world, and especially for child and adolescent. So we saw that no matter what was the policy implemented by the country, so the lockdown or wearing mask or social isolations and so on, physical isolation, not social. And we saw that the toll on youth people, on young people, was enormous. And we are now starting to see mental health condition increasing in this population and so on. So those are all factors that might combine, give a sense of the difficulties in prioritizing and making a decision, and the importance, as Stephanie said, to put young people at the center, to understand what matters to them, when, and to push them to advocate for themselves before decision makers.
Great, thanks, Valentina. Steph, are there good examples of success stories around financing? Has this worked in any context, in any jurisdiction, with any particular set of funders? You know, what can we learn from those success stories?
I would say one example, if I come back to the Australian context of success that I've seen, has been, I guess, a couple of things. So one is that in Australia, there's a youth mental health service called Headspace, and they are kind of centers all around the country. There are a number of them. They're kind of like a one-stop shop for young people to be able to go in and access different types of professionals to support their mental health. And the government has really invested millions of dollars into this model to help scale it around the country. But I think what we're also seeing is some investment into new innovations as well. So one example is at Batyr, the organization that I work at, we worked with over 500 young people to really look at, okay, well, what is a measure that can help support community and you know, feelings of hope and improving mental health literacy and decreasing distress. And so we worked together in developing an app called Our Herd, HERD, and the app allows young people to jump on and learn in a safe way how to share their own lived experience stories. It also allows young people to go on and access stories of hope and resilience from peers so that they don't feel alone. And we were able to do some research with Western Sydney University on the app and the efficacy of this on reducing stigma and improving mental health literacy. But it also allows decision makers to gain access to real-time insights from young people based on these stories to help inform their decisions, including government. And we were really fortunate to have the government recognize the importance of innovation and funding this. But what we sometimes see is, I was reading an article about a term called pilotitis. I might send it. It's really interesting thinking about, you know, funding that goes into the initial pilot of something, which doesn't continue. And you might see positive impacts. It might change the structure of an entire organization where you have to take on new resource, you're testing something, but then the funding doesn't continue and that's it. And we were fortunate enough to see the government recognize the importance of expanding something like this and backing it to continue over the next few years as well. And I think if we can see that long-term thinking where people can kind of focus on the work that is having good impacts and not have to focus on trying to bring in money all the time to make something happen, we can try to make some good traction as well.
Okay, thanks, Steph, for sharing. Reena, what do we need to do sort of while we are still dealing with COVID to try to address the issue of the impact of the pandemic on school and education and the impact on young people specifically? Is there anything that you'd like to share based on what you're seeing in terms of response in this domain, which is already being implemented, or where there might be some early successes, especially from Africa and other LMIC contexts?
Speaking for COVID, currently in our setting, we focus more on having more and more people access the COVID-19 vaccine, so that we have cases of reduction of COVID-19 cases and its also other effects that it's bringing up. But again, from a context right now, we're looking at the other consequences that the pandemic has brought into case where there's high cost of living. And with that, we are also going back to the conversation around mental health issues. We're still trying to recover from the situation, school programs being affected and young people going back to order of schooling and just understanding how to integrate back to the school system after being away for a while. So there's so much still going on. But again, we need specific interventions to be able to cushion, especially the most vulnerable communities against those effects, because those effects of the pandemic are highly likely to increase the issues around mental health challenges, which is what we are looking at curbing and reduction. So some of the intervention, of course, is access to vaccine, and also government being intentional about reduction of prices, especially on issues around food prices, which are affecting communities. Some of the economic stimulus packages, for example, access to business or seed funds from the government for vulnerable communities to be able to thrive, and looking at also youth accessing government procurement opportunities for them to be able to be self-sufficient and be part and parcel of participating within the community productively. So there's different interventions that are being done, but again, while we are seeing that, the progress is still quite slow, and it's getting us to a state where there's the more we are getting into a space where we need to come up with more and better interventions of how to respond to the effects of the pandemic while we are dealing with it as well. And this takes concerted effort between policymakers to be really intentional about looking at the situation in the country and being able to be intentional about improving the livelihoods of communities for them to be able to thrive. So basically, I would say we're doing something, but we're still very slow in the progress of what we are supposed to be doing as countries. Thank you.
Thanks, Reena. Dan, there was a question specifically around the clubbing of mental health with NCDs, and how do we make it more of, how do we ensure that it retains its identity and doesn't get lost within the NCD sort of conversation? So thoughts on that?
Yeah, very quick thoughts, because I noticed we only got 2 minutes to go, I think. Yes, you're right. There's of course some very compelling reasons for thinking about combined joint approaches to planning, delivery, monitoring of services for mental health and NCDs, perhaps more in the context of adult mental health and over the management of often very comorbid conditions in general healthcare settings. For child and adolescent mental health, I mean, maybe the more obvious links is with child and adolescent health more generally, and to ensure full integration with the thinking and planning on that side. So that's kind of, yeah, I mean, you're right that there is a risk that mental health could lose some kind of its own kind of visibility if it's sort of seen as part of a bigger NCD or 5x5 agenda. So I think a slightly nuanced approach needed. That there are often some very good reasons, and we're working. We work closely with NCD colleagues, for example, in implementing country-level programs and service delivery development programs. But there are other instances where it's important to retain sort of the clear visibility of mental health as a self-standing issue, and that's been recognized by some of the WHO member states. So I'll stop there.
Thanks, Dan. Yeah, we are almost all out of time, but let me quickly ask all our panelists for one last round of responses. So if I were to ask you to give me a tweet length answer, which means that it'll have to be under 180 characters, of in order to increase investment in child and adolescent mental health, we need to prioritize. Reena, you go first. What would you like to prioritize?
Good one. I think we need to be intentional about financing for mental health, not where we say this is implicit. The intention is there about financing for mental health, and not we are assuming or making an assumption that we are investing in mental health. Let's just be intentional about financing for mental health, and what specific programs are we doing that are intentional towards achieving sustainable financing for mental health.
Thank you, Reena. Valentina?
I think by now everyone knows what I will say next. So my tweet is, in order to increase investment in child and adolescent mental health, we need to prioritize integration on mental health action across sectors.
Excellent. Stephanie?
I think we need to prioritize ensuring that young people have a seat at the table to help us make smarter and more sustainable investments into the future.
Thank you. Dan?
I'm with Valentina. I've got, in order to increase investments in child and adolescent mental health, we need to prioritize multi-sectoral engagement, commitment, and aligned resource allocation on a locally determined set of interventions. So I'm sort of unpacking the integration idea a bit there.
All right, so instead of a retweet, you did a quote tweet with your own comments, so that's great. Thank you. Please join me in thanking my fabulous panel, Valentina, Stephanie, Reena, and Dan. This was a great set of conversations, and hopefully illuminated the whole issue of why we need more financing for child and adolescent mental health. And it's of course part of a larger conversation in the annual meeting. The next session will start in under an hour, and the registration link is in the chat window. Thank you again for joining, and take care, everyone. Bye for now.
Thank you and bye.
Thank you, everyone.